So today, everyone, it's always a new fun health topic, right? And one, it is fun, meaning like we've got to have fun with health and our bodies and taking control and learning new things. And it's just life. We always have to have more fun. But number two is I really want to bring you something that's educational that you can implement. I was going to say imply, impact wasn't coming, implement. I want to be able to always bring you something that you can implement into your life right away to make a big difference, right? So the question that is what I'm asking you, are you taking control? Are you taking care of the number one entry point for total health for you? And you might be asking, what do you mean the number one entry point? Well, before we jump right in, thank you guys for being here. Thank you guys for always, coming along the Kellie journey. And if you don't know me, my name is Kellie Lupsha. I've been in the health and wellness space for almost 30 years. I have been a physical therapist in my background, really help people from all sorts of neurological disorders, strokes, concussions, traumatic brain injury, brain cancer, other neurological disorders. And then 10 years ago, as I was aging and I was not feeling my best self, I really jumped into cellular health and wellness, into the field of functional medicine, peeling back the layers, right? And I went from feeling 40 to 50, feeling amazing, vibrant, incredible. Just this weekend, you guys, I just turned 52. Great, right? My Lyft driver couldn't believe it. He's like, there's no way you're 52. I'm like, I'm just bringing the energy. But it's because of what I've been doing. So thank you for being with me. Thank you for following. And if you love this, subscribe, follow me, go find my podcast. If you're on my podcast, thank you so much. Leave a review. It always helps so much. The name of my podcast is Thriving in Midlife. We talk everything about health and wellness. We have lots and lots of fun. I have a regular guest speaker, Dr. Heidi Arasabal, that she comes on with me. She's an ND, a naturopath, and a functional medicine practitioner. And then also I bring in special guests of all sorts of different health and wellness topics. So we just like to have fun and elevate our lives, right? So I hope you enjoy and you love it. And thanks for being here. So several of you guys are on lives. Say hi. Tell me where you're coming in from. I see some of you, and I know health and wellness is all your jam. Miss Shirley, great to see you. And so many others. So let me know. But hey, what we're going to talk about today, because I just got back from the dentist. So we are going to talk all about oral health. And you're like, what? Okay. What we put in our mouth matters. What we do to our health, our teeth, our gum matters. This is the opening to everything else that's happening in your body. Your mouth microbiome starts setting the scene for total health and wellness of the rest of your body. If you're struggling with your gums, with your teeth, with inflammation in your mouth, chances are you've got other health things going on, right? So I want you to start understanding, what are you doing to your health? And are you doing it because these are things you learned as a kid 30, 40, 50 years ago? Or are you doing it because you know it's science today? Because we're going to talk about some science today that really might blow your mind. Now, I'm not going to get into all the studies and all the literature. Typically, I don't do that here. Sometimes I'll give you guys a reference point of something, but in general, I'm not going to go down that rabbit hole. We're just going to talk about practical things that you can do. So, are you ready? Have we buckled up, ladies and gentlemen? Okay, so let me ask you, have you changed your toothpaste? Who grew up with like Colgate, Crest, Scope? What else? What other toothpaste? Give me another toothpaste that's out there that you guys used or maybe still use. The reason why I bring that up is because I'm going to give you a little bit of lesson on the history of oral health. If you think about it, beyond our grandparents, right? So go back more than that. Was there even such a thing as toothpaste? No. Was there even such a thing as a toothbrush? No. Was there such a thing as dental floss? No. So how did they prevent their teeth from falling out, their gums from rotting, not having like gingivitis? not having other health issues. This is how it really starts. Our society went from eating raw food, chewing. The forces of chewing on our teeth are the same or similar to, not the same, but similar to us going to the gym and lifting heavy weights. We need to put forces on our teeth, our jaw, for the shape of our jaw, our face, to make space for all of our teeth. People didn't go to an orthodontist. There was no such thing as braces back in the day. But we have changed the type of food we eat. We've gone to much more of a softer diet. We're not chewing, like using our muscles to chew our food. Let me ask you this. Drop in the chat, drop in the post. If you're listening to this later on in the replay, let me know #replay, but please answer these questions. And if you're on my podcast, like, I want to know, send me messages. When you're chewing, how many chews should you do per bite of food you put in your mouth? So let's guess. 10, 20, 30, 40. Gosh, my mouth and jaw might get really, really tired if I'm doing 40 to 50 chews per every time I put something in my mouth. What do you guys think? The number will shock you. It shocked me when I learned it's 30. So this is the next meal that you eat. I want you to put the bite of food in your mouth and start counting. 1, 2, 3 as you're chewing. And ask yourself, oh my gosh, are you ready to swallow on like chew 8, chew 10, chew 20? And then by the end, think about making yourself chew to 30, making yourself chew to 30. So we need that force on our jaw. We also need that chewing mechanism triggers things for our digestive process. And today we're not going to talk about like digestion and everything and how that kicks off different hormones that we need to have and different enzymes. But we need to be strengthening our jaw, using our jaw, working out our jaw. That's first and foremost, okay? The other thing is that we have an oral microbiome. And in today now, the Western world, not only have we switched to eating cooked foods, softer foods, smoothies, bowls, right? That we're not chewing. We've also gone towards using things to make our breath smell great. So we gargle with mouthwash. We want the most mintiest toothpaste possible. So they're in mouthwash. That's killing everything. So does it make your breath smell fresh for the moment? But actually, believe it or not, it will make you have over time worse breath because you're killing the natural flora inside your mouth that needs to be there for protection. So then you're going to get bad bugs in your mouth because you're killing everything. So today, we should not be using mouthwash at all. We certainly can use toothpaste, but we shouldn't be using toothpaste with fluoride. We shouldn't be using toothpaste with all this extra stuff. It's not the toothpaste. That really just creates something to make foamy, right? It's not the toothpaste that's actually cleaning your teeth. And when we brush, we're actually not brushing our teeth. We should be brushing. Are you guys seeing? I'm like showing you my teeth because I just have them cleaned, pearly white, right? So good, pearly white today. It's not the teeth. It's you're actually cleaning your gums. So you shouldn't be using something super abrasive. You should be using something gentle and a slight angle and a little bit like a round motion to clean up and into your gums, because up from where you can't see your tooth to your gums, you should be able to poke up there maybe at most about 3 millimeters. So stuff gets stuck all there. So you're brushing all of that. Ultimately, if you're not eating highly processed foods, sugary foods, you shouldn't feel like you have some weird film on your mouth. But when we eat foods like that, we end up with this strange film on our mouth. So cleanse your palate, chew your food, eat some raw vegetables. That will really help clean your teeth. It's pretty wild. Flossing your teeth. I never was a great flosser, to be honest. And I'm actually learning that if you get things stuck in your teeth and you can't get them out, you need to floss to get them out. But when you floss, instead of actually flossing and then creating like your gums bleeding, because every single time you floss and you get a little micro tear, you're opening up something for bacteria to come into your mouth. So interesting. So instead, tell me, what do you use for like a water flosser? There's all sorts of, there's like the water pick. Was that the first name of like, I don't know, it's the first one, but it's like really popular. But now so many brands. I have this like strange extra hair that should be in my ponytail. And it's not. So I'm like tucking it behind my ear. It's not staying in place. Sorry. But I want to know, we have a Hydro Floss that we've used, but I use the toothpaste I use is called Boca. So you want to be using toothpaste without the fluoride, you guys, okay? And if you brush your teeth and you go to eat something, you're like, oh God, it tastes weird. I just brushed my teeth. That should not still be in your mouth. You don't want your mouth to feel like that or taste like that after you brush your teeth. So I love Boca. I don't have my toothbrush or toothpaste or anything near me right now, but I use them to do my tongue scraping. I do floss when I need to, but instead now I use a water flosser versus a floss flosser, so it doesn't create damage or bring in a way for bacteria. So I also use the water flosser from Boca too, same. But you can use, there's so many out there. It shouldn't be so powerful, it's blasting and damaging your tissue. So you do want it to create a little friction, but you don't want it to go overboard. So be careful to create the right environment. But number one thing, it goes back to total health and wellness. None of us should be eating tons of highly processed foods, highly sugary foods that sits on our teeth, things that are like gummy, chewy that just get stuck in there, right? That may be giving you like tooth decay. I will tell you, I'm always looking for prevention, right? So when I went, I have not, because we moved, I could, like, people were like, don't go to these dentists, you have to go to this office. This office couldn't get me in for like 10 months. So I went like over a year without going to the dentist, which I hate to do. I'm pretty much an every 6-month regular goer. And I've had 3 amalgam fillings. That's the silver fillings. Do they even do them anymore? I don't know. It's on my wellness checklist to eventually get out of my mouth, but you need to go to either a biological dentist, somebody that's been trained on specific procedures to get it out of your mouth. Otherwise, you'll be more exposed to mercury in getting it out of your mouth than it just sitting in your mouth. On one of my teeth that I have my largest amalgam, I think I've probably had it in my mouth for like 42 years. The inside of that tooth starting to have a tiny crack. And the crack is because of the filling. The filling is so hard that it doesn't allow the tooth to move, and that's in the middle. And so therefore, any sort of give got to go somewhere, and now the tooth is cracked. Very, very little. But the dentist said you have 2 options. You can do nothing. You can wait till it totally cracks. When it cracks, we'll have to pull your tooth, extract your tooth, and then we'll have to put in an implant. So now you're talking about a huge surgery and operation. I don't really want my like jaw drilled in to have an implant in. I don't want a major surgery that could lead to, again, this opening is going to can potentially contribute to way other health issues. So my second option is I put a crown on it now, and then 1, my amalgam filling is gone. But 2, then my tooth is not going to crack. Then I don't have to wait and have my tooth extracted and have an implant put in. So it looks like I have a crown in my future. Okay. Not the end of the world, but like, all the stuff if it's not necessary. So I really employ you to check out what toothpaste are you using. It should not be harsh, full of harsh chemicals. There's all sorts of more natural toothpaste out there. Again, if you guys want, I don't have an affiliate link, nothing for the company Boca I love. But you can use that. It's Boka. There's now even like these jars that are almost like a powder that you make it and then it turns into a paste in your mouth. There's a lot of different things. I would just say let's start getting away from the commercial toothpaste. And toothbrushes use something soft. Maybe you're using electric. Probably you should use electric. I'm using electric today. Be careful. I mean, I'm not going to say don't floss. All your dentists are going to say that's crazy. You should floss, floss, floss. But if every time you're flossing, you're creating a lot of bleeding, something is amiss. You should not be bleeding. So I would suggest you use a water pick instead of flossing. Okay. So those are just some suggestions. Um, Other things that what you can do. I have a tongue scraper to scrape the bacteria off my tongue. So I should use it daily. I don't know. That's the one habit that sometimes I use it half the week, not the whole week. I don't know why. Just being honest, not perfect at everything for sure, you guys. So I'm just sharing my experiences. The other thing that you can do is oil pulling. And I will have somebody on for a whole later date on just a podcast just to talk about oil pulling. It's very interesting. It's been around for years and years and years, centuries, really. You're just going to put a little coconut oil in your mouth and swish it for like a long time, meaning like 5 minutes. That's a long time. But yeah, it's great for the health of your mouth and your gums and everything. It's amazing. It's so funny, right? That we stick with practices, and just like now, regular MDs, you're like, why am I going? They're not helping me. They're just putting me on a medication. They're not helping get to root cause. Funny enough, so absolutely love my new hygienist today. She was so cute. We got along fabulous. So then the dentist came. These are all new people to me. I'm not saying any names, but my new dentist, young girl, fabulous. We started talking about health and wellness. She has a significant health issue going on right now. And she said, she goes, you know what? I think my husband and I have finally decided that we're going to like eliminate traditional medicine out of our practice. They're seeing a naturopath and they're like, I can't believe us being in the medical industry, we don't even want to use our own medical system. And it's so true. And so it's interesting her being a dentist now, starting to understand, because in dental school, they don't teach you, you have to learn after the fact, this length of oral health and wellness to overall body wellness. Really, dentists should be helping teach us about nutrition, how we chew our food, the types of food. Have you ever been educated like that by your dentist? I never have. I follow some biological dentists and people in functional medicine, and I'm learning along the way with all of you guys. And that's why I like to bring easy, actionable steps today that can really move the needle further. So, couple things I want you guys to tell me. Are you going to stop using mouthwash? Done. It's out. Do not kill all that flora. Bad idea. 2, are you going to swap your toothpaste for something much more natural? And 3, are you going to invest in, a water pick, a water flosser of some sort to really help maintain the health of your teeth? Those 3 things, right? I'm leaving you guys with. But also my challenge to you, and I want you guys to be telling me, like on average, what is it when you put a bite of food in your mouth and you start to chew? What number chew are you on before you feel like you're ready to swallow? I bet it's not 30. I bet it's not even 20. Could be like 8. Maybe for some of you guys out there, 12 to 15, but most of us like 5 swallow, 8 swallow. No, chew your food, chew your food, chew your food for the health of your mouth and the structure of your jaw. Chew your food. So you guys, I hope like this was helpful. I actually love going to the dentist because I do take good care of my mouth. And so it's fun to have them go, wow, you got such good gums and such good teeth. You know how they do the measurements, right? Like 2, 2, 3, 2, 2, 1, 2, 3, 3, 2, 2, 3, 3, 3, all those numbers. So if you've got 5s, 6s, then you probably need a deep cleaning. I asked my dental, I had none. You guys, I have all 1s, 2s, and 3s. That's so good, right? So good. So I hope you do too. I'm trying to help you. These tips will help you. So I asked her, what's like the biggest number she's ever seen on somebody? And she's like a 16. I'm like, oh. She goes, yeah, their teeth were literally about to fall out of their gums. I'm like, of their jaw, like literally there's no gum tissue there. Oh my gosh, somebody's really needs help taking care of their teeth. Oh my gosh. So, what do your numbers look like? And you should be proud of them. Like, just like you want a certain amount of cardiovascular health and certain amount of like your blood pressure and right? Like that's like the fit. How fit is your mouth is by those numbers. Um, all the stuff, all the things. All right, you guys. Well, hey, I hope this was helpful because this is the number one entry that we need to be starting taking care of when we're thinking about total health and wellness. So I'm going to be bringing on a biological dentist. I'm going to have them talk everything, all sorts of stuff. The one thing that my doctor said is, wow, you have very little inflammation in your mouth. Hey, we all know about inflammation. We all know I preached to you guys about inflammation. You all know that you need to be rocking your Nerf 2 to reduce inflammation, right? So I hope you listen. I hope you're doing the thing, the doing the do, and and let's all go out there and have a better journey with our oral health. Are you guys in? I'm in. It's total health and wellness. Can't forget about the mouth. One of the most important places that it starts. So with that, if anybody has any questions, I'm going to put a reference to another podcast that gives you a deeper dive by a biological dentist in the show notes down later on. So if they may not be right here on comments on Instagram or Facebook. So if you're like, oh, I want to get them, this will air on my podcast in another week or two. So go back to that and grab it in the show notes. It's absolutely amazing. So with that, thanks for everything. Stay tuned to some really fun upcoming things. I invite you to join me. It's going to be really, really exciting of Dr. Heidi Rossabal and myself. If you want to know more right now while you're on live with me, we are going to be putting on not a 1-day, but a 3-day women's wellness retreat. It's going to literally something that you cannot miss because if you think about the most important things is the community of the right people you hang around with, implementing small strategy of your health and wellness that are going to rapidly make results in your life, learning how to put this in practice. You're going to actually have skills that you get to do. We're going to actually do tasting of different things like wines and coffees and waters of how do you know if they're clean or not? Why do they taste differently? Why does it even matter on our bodies today? All sorts of interactive things that you guys are not going to want to miss. We're going to have sessions, breath work and yoga, you name it. So tell your girlfriends now, book out November 1st, 2nd, and 3rd. You're going to fly into Dallas, Texas for the weekend. Details will be coming, but block off that time and tell me because we have limited spots. So this will fill out. So I want you to tell me, Kellie, get me on the list. Get me on the list because then you probably also want early bird pricing and all this stuff. And the swag, oh my gosh, I can't even wait. The swag is off the hook what you guys are going to get. There's also going to be a VIP promotion that's going to be part of this that you might want to upgrade. Anyways, let me know if you want the list so you can get the first details when they come out. All right. Until next week, you guys, it's always fun to be here with you. Be sure to send this to a friend of yours that are like, you got to follow this chick. We have a lot of fun together. All right. If there's a topic you want to know about, you got to let me know and I will bring in an expert just for you. Okay. All right. We'll talk soon.